Hey social media, it's me again and I'm liking my new hair piece. Yeah. Okay, well actually I'm just coming to give you a quick little briefing on the things that you expect, well actually the things you should do before chemo. And at the same time, trying to do something with this new hair piece. I like it, but it don't look like it looked earlier. Earlier it had like these kind of cut layers that curled a certain way, kind of flipped up. It was kind of cute, but now I don't know what happened. So what I'm gonna do is I'm just gonna try to flatten it out, straighten it out, and possibly work with it that way and see what it do. So let's kill two birds with one stone. And I can go ahead and go over and talk about some of the things that you might need to do, like if you have early stage breast cancer and you're going through chemo, there are a few things that you should get done before you actually start chemo for clearance. You know. So one of the things that I had to do before my chemo begins, I had to go to the dentist. Yeah. Reason being, now some of the chemotherapy drugs will cause your blood platelets, the things that cause your blood to clot, the clotting factor. Yes, well, the chemo drugs, it kills the cancer and it also kills some of those blood cells that cause your blood to clot, so that if you're brushing your teeth and your gums are bleeding, that won't be a good thing because it'll be difficult for the bleeding to stop. So they recommend that everyone that will be going through chemotherapy, that everyone does see the dentist to make sure that they don't have any bleeds or anything, gum bleeding, and that's just one of the things they do for clearance. So I have my clean dental bill of health. Okay. All right. Another thing. I had to get something called a MUGA scan. MUGA scan. MUGA scan. It's a scan of your heart. They had me lie on this little small bench like table. It kind of looked like a weight bench, a white weight bench. That's how skinny it was that I had to lay on. So it looked like this little weight bench that was going through like this type of x-ray machine. They injected me with some type of radioactive material. It wasn't the dye that caused me to urine blue for 3 days, but it was some type of radioactive material. And they also warned me that once I leave my appointment, if I'm going to the airport, I should notify them that I just had another scan of my heart, so that airport security won't think that I have a bomb or something, on my person. Yeah, so I'm not going to the airport right now, anything, but that's just some advice. If you ever have a MUGA scan, you will have radioactive material in your body, and it can be picked up on the screening devices at the airport, especially most international flights. Okay, well, back to the MUGA scan. It's not really a painful procedure. The only pain is when they inject you, when they draw your blood, which is a pinch, and they inject you with the material. It's not very bad. It's just like a regular old, needle stick. That's the only thing you will feel. And they accessed through my port. Kind of hard to see because it's healing rather nicely. But yeah, they accessed my port. They had this device. It's kind of like they just plugged it in, like how wall socket, how you can like charge your phone or something. Yeah, so they plugged this device into my port. I made some type of, the whole word is porta-cath, but port for short. So I had this little IV plug dangling so that they could administer the drug through the end of the IV. And so after they did that, I sat in on a little white weight bench with my little pillow, and I went through the x-ray machine. That lasted about 30 minutes, maybe 40, but it wasn't bad. Just had to lay there with my in sit-up position with my arms behind my head. you know, I was laying up in sit-up position, just like this on a weight bench. Well, it's not a weight bench, but it kind of looks like one. It was actually the Megascan. I forgot the thing that you lay down on before you go into the Megascan. Okay, so the Megascan picked up the rhythm of my heart. It detects how the blood is flowing through my heart. See, the injection that they put in, it makes it, I guess, glow on the machine, and it can tell how my heart is functioning, how my blood is flowing in, flowing out, circulating, all that other good stuff. So that's what the Megascan does. And based off the results, they'll let you know if you're able to handle, you know, the certain chemotherapy drugs. And you'll also get tested midway through your rounds of chemotherapy to make sure that, or to see how it's affecting your heart function. I know some chemo drugs, it does have the capability to damage your heart. Hopefully that won't be the case in the medications that I'm taking, but they still have to, you know, keep close watch just in case. All right, moving along, I also have a PET scan to do. It looks like this hair is not straightening out. It's just stubborn. It won't keep these curls, don't it? Yeah, but I do have a PET scan coming up, and you probably heard of a PET scan before. They also inject you with something. The PET scan is going to determine if and where the cancer has spread throughout my whole body. So it's going to not just detect the heart or, you know, the breast area like I have in the past, but they're going to check me, you know, from my brain head all the way down to my toe. And they're going to use that to try to determine how or if, you know, the cancer is in any other area of my body. And I would also have periodic checks of that as well, you know, to see, you know, if how the chemotherapy is responding with my body. So that's another thing to prepare for. Also, I've told you in previous videos, like the side effects of the chemotherapy. Most people get nausea and fatigue. Not really looking forward to those side effects. The hair loss, I can care less, because as you can see, these wigs actually are easier than trying to maintain my own hair. And I'm not going to cut my hair because I want to show, you know, the progression of what the chemo is doing as far as the hair loss and growing back and whatnot, so that it can be documented. So I will be showing that, you know, so maybe the wig will come off next week. So we'll see. I'll show you and document it. But right now, this looks cuter than my natural hair. So this will be my new look until I change it. I guess. Oh, this stubborn piece just will not flatten down, will it? Yeah. But I do thank you all for listening in. I thank you for your support. I thank everyone who's been so helpful to me during this time. I appreciate that. I do appreciate you. God bless you. And I'll see you next time. And hopefully next time this will be taken care of. Bye-bye.